continue with these medications regulations, particularly controlled substances. So that's basically what we're gonna do. So remember, we were talking about where the medication, what are the sources of the medications, where the medications come from. In other words, where do we get, the materials to get these medication, these drugs, to manufacture them. And certain regulations, once again, that, enforces that the medication that is going to come out to the market and used for humans, it is safe. So that's basically what it is. So we're going to talk about these controlled substances. What do we call it control? Because these are the medications, once again, that causes people to abuse them or to become addicted to it. So these are not the medications that we are going to use for regular medical conditions like diabetes or arthritis or gastritis or any other type of medical condition. In general, is more likely medications done for pain and psychological medications for anxiety, people who have depression, people who have problems with hyperactivity. So people who have problems with panic attacks. Those are the medications that we are talking about. And we have many of these people, and not only that, we have other people who wants to abuse medications. So that's basically what it is. They use it as get away from problems and issues. Instead of, using illegal drugs, they use drugs that are legal, thinking that that's going to be safe, which is not. So that's particularly what it is. Now we talk about the DEA, which is the Drug Enforcement Administration. Remember, this is the organization, it's a federal organization that controls how these medications are dispensed. That's basically what it is. So that's why a medical doctor needs to get this license if this medical doctor is planning to prescribe controlled substances. Not every single medical doctor prescribes these medications. But if a medical doctor decides to prescribe these controlled substances, then they have to get this license. They have to apply for it. You apply online, you complete an application, you submit all your credentials about being doctor, what type of doctor are, and things like that. So after, the DEA review your credentials and the place that you're working at, then they are going to submit your license. That's basically what it is. And when you start prescribing medications that are controlled substances, they are going to monitor the medical provider who's prescribing these medications. This is not something that, you have a license and you just do whatever you want. No, for these controlled medications, the medical doctor is going to be monitored very close to see if this medical doctor is prescribing too much of this medication or prescribe these medications for no reason. So that's basically what it is. Medical doctor can lose their medical license if they prescribe this type of medications without the proper control. So that's basically what it is. So many people has lost their license, many doctors, because they have used this license to indiscriminately, prescribe these medications. So that's basically what it is. You have to be very, very careful with this type of medications. Recording. Okay, so I'm recording. So that's basically what it is. So the DEA is reinforcing the control of the substance because they are monitoring you. Every single time the medical doctor prescribes a controlled substance, immediately goes, this information is going to go to the DEA. That's basically what it is. Let's say I prescribe medication today for patient A. The DEA already have this medication through my license because they are the one who are, giving me the license, the DEA. So for that reason, through that license, they know which controlled substances I'm prescribing. How often I'm prescribing these medications. You can't just prescribe. This is not the way it is. This is not a regular medication. This is a medication or a drug that can make you addicted. So that creates a problem. So that's basically what it is. Now, these licenses or DDA license needs to show on the prescription when you prescribe a controlled substance. So it has to be a stamp right there that says DEA and the license number from the doctor, not the original license as a doctor. No, the license for DEA, because this is a different one. Remember that I told you that. So once again, if a medical doctor graduates from medical school, they can prescribe certain medications, but not controlled substances until they get the DEA. Other than that, you can prescribe those medications. So that's basically what it is. And the medical doctor has to renew this particular license every 3 years. So every 3 years, this license, the DEA license, expires. So question for exam. They're going to ask you something like this. It's not exactly, I'm just telling you what I heard, what's being asked. They're going to ask you, okay, so in order to prescribe controlled substances, what license the medical doctor needs? DEA license. That's basically what the answer is. Simple, straightforward. Anytime that you hear the word controlled substance, immediately think about DEA license. Because remember, without the DEA license, the medical provider cannot prescribe these controlled substances, period. Remember, controlled substances has nothing to do with the regular medications for these very regular conditions. These are totally different medications. I don't need a special license for that. Just the fact that I'm a doctor, I can prescribe. So that's basically what it is. So don't forget this. Okay, so how do we control these substances? How do we keep documentation? How we can keep these medications safe, secure in the workplace? Remember, these medications, if they are not in a locked cabinet, or else somebody's going to put the hands on it, and whoever is in charge of that particular medication or department is going to be responsible for it. So that's basically what it is. So these are medications that usually we keep in hospitals. Doctors' offices, they don't carry these medications. Usually the patient goes to the hospital, and remember, the hospital is a large institution, so they are going to have all these medications that are needed for any circumstance that the patient might go through. So that's basically what it is. So every single time that a medical doctor prescribes these controlled substances, it's got to be a special prescription pad. There are 4 copies. Goes to different places. One goes to the medical record of the patient. The other one goes to the pharmacy. The other one goes to the DEA. And the other one goes to, if you get in trouble, to the Department of the Inspector General, because that is the one that investigates as well as the DEA office. So that's basically what it is. So you're gonna have copies everywhere. It's not like the prescription pad. You have only one prescription. You give it to the patient and we record that in the medical record. That is it. We don't have copies of everything because no need. These are not controlled substances, but for the controlled substance, we have to do that. So we are going to keep these records separate from other records, from other medications. So controlled substances are going to be kept separately. They are not mixed with any other documentation. So in the progress notes, which is where the medical doctor records all the information about the patient and the medical conditions, diagnosis, well, they're going to record there what medications were given to the patient. You're not going to touch the prescription pad there. This prescription pad is kept in a different record system. So that's basically what it is. Now, these records needs to be maintained daily. Every single time that a controlled substance is used, you have to keep records for that. So that's basically what it is. Now, these prescription pads from controlled substances needs to be kept for a minimum of 2 years. Well, you can keep it for a little longer than that, but the minimum is 2 years. You cannot destroy, you cannot say, oh, well, I don't know where that prescription is at. You need to keep it for 2 years, at least. So that's basically what it is. You do not mix controlled substances with regular medications, like medications for diabetes, arthritis, or other medical conditions, because these are controlled substances. If we keep the records of these controlled substances separately from anything else, well, the medications as well, we need to keep them separately. They are secure. They are inside a cabinet, a safe. Only one person is going to have the key to open that. And that person is responsible. Every single time that someone's in charge, they got to sign in, they receive a key. If they keep it some other ways, well, they're going to give you a code. But this code keep on changing every single time a person is in charge of that locker, cabinet, safe, whatever the case may be, where, we keep these medications. That's what it says right there, minimum employee access. If you don't have access, you don't have the key, you have no business whatsoever to go get these medications. And only you get access to this if you're a nurse, because the medical doctor has given you an order. Already you have an order. Other than that, even though if you have a key, you cannot take any of these medications for no reason. So that's basically what it is. So these keys are very, very safely protected. So remember, the person who's been assigned the key on that particular day, on that particular shift, signs the document, and it is responsible. Every single time someone comes over with a doctor's order, a nurse says, hey, not every single nurse is going to have the key. No, they're going to have to go to this person who has the key and request that medication to be dispensed. Of course, they have to show the doctor's order. And the person who has the key, which is usually a nurse, because those are the ones who knows about medication, so they can understand the order, so they know if it is real or not, or if they want to verify, they can call the medical doctor who prescribed that medication or gave the order to the particular nurse. So this is very serious. Remember, yesterday I mentioned that most of the medical providers, they use these drugs for themselves. So you have to be very careful. Because if you are the one who is in charge of, have the key for these cabinets or this locker or whatever the place these medication, these controlled substances are kept, so then you're responsible. You are responsible for anything happens to those medications. Every single time someone comes with an order, you have to document it. I dispense this medication, this dosage to this person this day at this time, and then you sign. So that's basically what it is. Medications cannot just be given to someone without a medical order or without documenting this, because you, the person who has the key, are responsible, because they are doing inventory every day, every end of a shift. Someone is going to come over and receive that key, and it's going to do an inventory, and it has to be documented. So once again, it's very serious keeping these medications. So it says right here, requirements of controlled substances, once again, kept in a locked cabinet or any other safe place that can have a key. They're going to use a form from the DEA if something happens. Remember, this is like the incident report form, but this is from the DEA. So that's basically what you need to do. So once again, if theft means you went to see and you did the inventory of the medication, the controlled substances, everything that it is in that cabinet, and it turns out that something is missing. There is no documentation for it. Immediately, the person who's doing this inventory every day needs to report it. Use this form. So that's basically what it is. Because remember, the person who had the key is responsible for that. So they have to sign. And then an investigation is going to start. It's not going to stay there. It's not that we're going to kind of fill in a form that medications are missing and then leave it alone. No, that's going to go through an internal investigation until they get to the bottom of the situation. Now, if you have to discard these controlled substances, now, again, can't just say, oh, medication didn't work, or the medication was expired, or something was wrong with the medication, so I just throw it away. No, can't do that. So before you discard whatever you think that was expired or was contaminated or for any other reason, or discontinue, then you have to have a witness over there. So you're going to go over all these medications. Oh, I'm going to discard this. I'm going to discard this. Then you call someone who is in charge of that particular task. You do not discharge or get rid of any controlled substances without the presence of this person from security department. I'm talking about someone who's in charge, not a guard. It's someone from the medical who understands the medications, who understands the process. So that's basically what it is. So they send, someone who really knows about what is going on. We don't discharge, we don't just get rid of the medications, throw in the garbage can or in the sharps container. No. We have companies that are called to come and pick up these particular controlled substances that we're going to get rid of. So that's basically what it is. This is like the sharps container, the one that we throw the needles, the blood tubes, in lancets and scalpels and anything that is sharp. We don't just discard it in the regular garbage. We have a company that comes and pick them up and they destroy them. They incinerate all these and they have to sign a report. But this is a company that is approved by OSHA. Well, this organization for the controlled substances needs to be approved by the DEA. It's not just someone that shows up over there and said, hey, I get rid of that. No, it has to be some proper procedures that you have to follow. So that's basically what it is. So you have a witness, you have someone who's going to be discarding these medications. Now you have to fill out these documents of what medications, how much, what was the volume of each of these bottles, and what was the expiration date, what was the lot number. So you have to record everything to know exactly which medications and from what batch these medications came from. So that's basically what it is. If there is any type of investigations later on, we have records. And we have records of how we discard these medications, remember. So that is basically how it is. This is very, very serious. I'm telling you, you can lose your license, you can go to jail for that. So nobody wants to get involved in this. So that's basically how it works. So we have to be very careful with these medications. Fortunately, because you're not a nurse, you don't have to be involved. But that does not mean that you're probably not going to know where these controlled substances are. So remember, only personnel that is authorized to handle these drugs, these controlled substances, are the only ones that can do that. Anybody else should stay, away from this, because that is getting in trouble. So that's basically what it is. When I was working at the hospital requested the DEA for me because I'm not a individual doctor. I don't work in a medical doctor's office. I don't have my own doctor's office. I work for someone else. So they get it for me. They have all my information. They have my license. They have everything. They submitted everything because I'm working for them. So they want me to prescribe these medications or to give this medication because I was not prescribing. I was working in emergency. But in the emergency, we do give very heavy medications. So once again, and most of these medications are controlled substances. So we have to have license to give these medications or administer these medications to the patient. It's not that I'm administering the medication myself, but I order the nurse so the nurse can give it to my patients because they are in a very, very serious condition, particularly pain. So that's basically what it is. But I did have this. It has to be there. If I prescribe medications to my patients after they've been discharged from the emergency, now I have to give them a prescription, and the DEA number with a stamp from the hospital where I work needs to be on the prescription pad. Without that stamp in my signature, my license, which is there because I'm not going to be writing down my license number every single time, we carry a stamp. Each doctor has their own stamp. With the license as a medical doctor, the DEA license, we just sign. That is all we have to do. Without this, pharmacy will not dispense any of these controls. Well, They're not going to dispense any medications without that needs a prescription anyways. But for controlled substances, it's a lot more strict. So that's basically it. So you're going to see this in every single medication that is going to have the letter C. Now, letter C, and inside you see Roman numbers. So basically, that's what you need to pay attention, because here is controlled substance, and this is schedule 3. Because schedules goes from 1 to 5. All these are for controlled substances. We are going to discuss that next, because it's very important that you understand the schedules of medications, because there will be questions there for you on your exam. Yes, you have no business anything wrong. Yes, you need to know which substances you can call which controlled substances only the medical doctor can call. Medical doctor should not delegate certain schedules, meaning, hey, call the pharmacy for this medication. Well, if it is a regular medication for a regular condition, no problem, you can call. If it is certain schedule numbers, you might be calling, but certain schedule or certain schedules for controlled substances, you cannot call. Only the medical provider can do it, no one else. Remember, this is not for regular medication. This is for controlled substances. So you're going to see the letter C and the schedule right here in the middle. So this is schedule 3. There's a schedule 1, 2, 3, 4, and 5. Of course, you're not going to see number 1 because number 1 are illegal drugs. So for illegal drugs, we don't prescribe illegal drugs. So we're going to go over that. So that's basically what you need to understand. So remember, medical assistants do not prescribe, do not diagnose, none of those things. They do not give medications. Keep in mind, because these are questions for exam. Because medical assistants, what is it that medical assistants do? Well, they just check the vital signs, do electrocardiograms, they draw blood, like you assist the medical doctors during procedures, but you do not give medications. So basically, that's what it is. We will talk about what medications and what routes of medications are we talking about. So that's basically what it is. So now we kind of heading towards schedules now. So there are 5 schedules. Remember, we use Roman numbers. This is schedule 1. Pay attention to this because this is a question for exam. They just want you to know, to understand, so you don't get in trouble. Not legal for use in the United States. So this is a drug that is not legally prescribed by medical doctors, like heroin, LSD, ecstasy, marijuana. They are not legal. Now I know what you're thinking right now. Oh, no, it's legal. Oh, in the United States, a few states, which is medical approach and some other type of, situations, but it is not legal. Still shows as Schedule 1 because it's still in the process of legalization. So certain doctors in certain states can prescribe marijuana, but it's not marijuana, the raw leaves or anything like that. Those are extracts, comes in different forms. So that's basically what it is. But it's not being legalized completely in the United States, and within the schedules, still a controlled substance. So that's basically how it is. You still can get arrested if you are doing, you caught doing marijuana when you're not supposed to, or if you don't have in the state that is approved. Just because the state have approved, it's still in the process of legalization. So still the schedules, marijuana is considered Schedule 1. So cocaine, crack, all those things are belong to this schedule. Remember, these are illegal drugs. This is not something that medical doctors are going to prescribe. Not as of yet. So that is Schedule 1. So remember, for Schedule 1, these are not legal medications or drugs in the United States. So forget about marijuana. Don't go fall for it, because it's not approved yet. They are in the process. Only few states allows marijuana, but that's not imply that is that is being removed from Schedule 1. No, not yet, and not in the near future. So for now, just keep it in mind for your exam. They're gonna ask you, okay, so which of the following schedules is considered illegal to use in the United States, or a drug or a substance? So that is Schedule 1. So that's C. So we're going from the top. Are we going in ascending order from 1? Now we're gonna go Schedule 2, then 3, 4, and 5. Schedule 2, high potential for abuse, and of course, for psychological abuse, addiction. Now, it has legal medical uses in the United States, but that's when you are going to use the DEA license to prescribe these medications. So you probably heard about some of these medications. They are very, very addictive, and people abuse it a lot. So that is the problem. That's why they came out with this Controlled Substance Act, because people were using all these drugs indiscriminately. So then you become addicted, then we have problems. Now, you have to use health insurance and many other services from medical when we can stop this, but just, prescribing these medications to people who really need it in certain amount. These controlled substances, medical doctors prescribe a 1, no refills. No refills. Only once, for 1, 2 days, or maybe once. Anything else, you have to go see a specialist. And that specialist determines if you actually need to continue with this medication. We use it in the emergency because, well, patients are in a critical condition. So most of the time, to relieve pain, we have to use this type of medications. So that's basically how it works. So this is Schedule 2. For instance, we have here as examples, Demerol, morphine. In my situation, in the emergency, I use morphine a lot for certain patients. Now, never prescribe anything else. Oh, maybe Tylenol with codeine, but that's not Schedule 2. It's a lower schedule. So that's basically what it is. So we have Demerol, morphine, Ritalin, methadone, oxycodone, hydrocodone, codeine, fentanyl, you name it. Remember, oxycodone is the same as OxyContin. So people get addicted to these medications. And not only that, people request for these medications and then they sell it to the addict people. So they use this, because they think, oh, these are legal medications. Well, I can just request it from the medical doctor. They're going to prescribe it to me. Oh, not so fast. That's not how it works. You might get it once, but then if you want it the second time, we're going to refer you to a specialist. If you're suffering very bad pain, then we send you to pain management. And pain management is a whole routine investigations, observations to see if you need the medication or it is that you are abusing the medication. So that's basically what it is. So once again, these are very, very, very strong medications, and they are under these controlled substances because, once again, they have the potential for abuse and addiction. So that's basically what it is. You don't get addicted to Tylenol. You don't get addicted to diabetes medications or gastritis medications, to hypertension medication. You don't get addicted to those. Actually, you even forget to take those medications. But all those other ones, no. You take it and every single time you have to take more and more and more. Because the effect of the first one is not going to be enough. Remember, that is called addiction. So that's basically what it is. So that will be Schedule 2. This schedule, medical doctors needs to call the pharmacy for these medications. No one can call. No nurse, no one else. Is the doctor who prescribed the medication is the only one that's going to call the pharmacy if the patient needs this medication. So that's basically what it is. No delegate. So be very careful that when the patient comes in and most have a medication refill or they don't, you don't know the name of the medication, you don't know what the patient is taking this for, don't volunteer yourself to do anything because you lose your job and more. So again, very serious with medications. Schedule 3. Now, these also have potential for physical dependency. Now, once again, all of them have, the potential for physical dependency, psychological dependency. But as we move kind of up the ladder, every single medication potential for physical dependency and psychological dependency is going to be taping down. It's going to be one, very addictive, but it's not legal. Number 2, very addictive. Then number 3, less addictive. But still, we need to be concerned about this. So here, for instance, you can be familiarized because probably you listen to the news, particularly sports people that use steroids to enhance, the strength and beat the competitors or whoever else they are competing against. So that's illegal. So that's basically what it is. So there are many others like barbiturates, anabolics, things like that. So once again, you're not going to be asked about this schedule. Schedule 1 because it's illegal. No medical doctor prescribes them. Schedule 2, they are legal, but only medical doctors can prescribe and call in the pharmacy for refills if it is needed. No one else can do it. Here, medical assistants can call for medication refill if it's needed. Once again, under the supervision or under the order of the medical doctor. It's not that you just patient just come in, hey, I need my steroids. Sure, not a problem. Let me call the pharmacy. No, every single refill, regardless whether it is controlled substance or not, gotta go through the medical doctor first. So that's basically how things are handled in the medical setting. So never take, anything upon yourself and decide that you're gonna do it. Oh no, the doctor is very busy. Last time the doctor asked me to call refill for this. Well, I can do it for this one. Well, you don't know the schedules. You don't know the cumulative amount of the medications on the patient's body. The medical doctor probably needs to do an evaluation, maybe needs to order blood work to see. Now you are bypassing all that. The patient gets in trouble, you get in trouble. So basically, that's what it is. So all the time, every single patient comes into the office, any request from the patients got to go through the doctor. That is it. That's how it works. Schedule 4 is going down, low potential for abuse, compared to, of course, the prior schedule, which is number 3. It is used as a medical approach here in the United States. Now, for this schedule, here we're going to have all the family of the benzodiazepines. That's basically what it is. So we have Valium, which is diazepam, Ambien, Clonopin, Xanax, and a bunch of other medications that are used mostly for psychological problems. Remember, most of these medications are used, and these are controlled substances, are used for anxiety, stress, bipolar, anxiety, panic attacks, hyper activity. Well, even for insomnia, if you kind of not falling asleep because you have a lot of issues, so then they can prescribe some of these medications. Very addictive. This has low potential. They are addicted. Not as much as the other ones, but they are addicted. That's the reason why they are part of these schedules. Schedule number 5. This is the lowest potential for abuse based on the prior or previous schedules. So once again, it is used in the United States for medical purposes. Here we have medications that probably you have taken. We have Lomotil, Robitussin, but these are medications that contains codeine. So that's basically how it is. And these medications in particular, they are prescribed medications, remember. If you're gonna get Robitussin, the regular Robitussin is not the AC. The here C stands for control and codeine. So that's basically what it is. So Lomotil usually is used, I prescribe this a lot for diarrhea. When someone has diarrhea, doesn't stop, we give this medication, that stops immediately. Because when you have diarrhea, your intestines are very hyperactive. They are contracting very fast. That's why they kind of push all the stools out. So this medication is given for that reason. I prescribed this many times, Lomotil. Robitussin, never prescribed that because mostly is used for cough. somebody has this very bad cough, and a Spectrum and everything else. So they give you this, but not talking about the regular Robitussin because that doesn't need a prescription. You can get it over the counter. Now, if you remember not long ago, the teenagers were using Robitussin to get high because it has codeine. So then they locked these medications in the pharmacy. They used to have them open on the shelves. Now you have to request for that medication because it is locked. So that's basically what it is. Donogel is something like Lomotil, also used for nausea and vomiting or for diarrhea. So that's how it works. So remember, these medications have some degree of narcotics. They have something, starting with Schedule 5, which is the lowest, and then 4, 3, 2. Forget about number 1 because those are illegal drugs. So think about drugs makes people addicted. Abuse means that they are using it more than is needed because they feel good. Not about the condition that they have, is mood-wise. They're gonna feel, oh my God, I'm so stressed out, I'm just gonna take something instead of just dealing with, right? Of course, there are certain situations in which you definitely need these medications. Then you go to the doctor, they have to be prescribed. So that's basically what it is. Now, from Schedule 3, 4, and 5, you as a medical assistant, you can call in the pharmacy to get a refill. Remember, Schedule 2, there is no way. Medication has to be prescribed and call the pharmacy by the medical doctor because these medications are very strong medications. So that's basically what it is. So remember that because that's very important. I heard some of these showing up on exams, and I want you to be aware of that. So if something is being asked, it's going to be asked about once again, what is the DDA license for to prescribe controlled substances? And Schedule 1, those are illegal drugs. Schedule 2, remember, this is only the doctor can call in for medication refill. Anything else, you might be allowed to do it, particularly Schedule 3 and 4, 4 and 5. So that's basically what it is. Any questions about these schedules? Now we can call Schedule 6, 7, 8 for all other medications, but they are not part of the schedule because they are not controlled substances. So there is no Schedule 6, 7, 8, 9, 10. So remember, it's only up to 5. And we use Roman numbers. And what is it that these medications are called controlled substances? Because they have a potential for abuse and addiction. So those are the points that I want you to remember just in case you can ask your exam. Any questions? Remember that because these medications are controlled substances, you have to keep them locked. Of course, you have to have a control how to dispense this, how to discard this medication. This is not just like any other medication. Oh, this medication is not good, expired. Oh, throw in a garbage can. No, this is a lot more complicated than that. Okay, so inventory and ordering of controlled substances. Now, remember that I told you that someone every day is doing inventory of everything that, at the start of the shift, they receive. It was in the locker under key. And then at the end of the day, someone else is gonna go back again and monitor that, do the inventory again. So that's basically what it is. So you have a logbook there, and you're gonna keep all of these medical drugs. So you have a list of the medical drugs, you have a list of each name of the medication, how much of that medication was does in that particular vial, bottle, whatever the case may be. And if one medication is missing, then you got to prove that the medication was given to particular patient, and the prescription, the order from the medical doctor needs to be there. So that's basically what it is. Remember that these log books for medications are need to keep also for 2 years. Not talking about the prescription 2 years, but the log books, because you want to compare the prescription with the log book. And the prescription might say one thing, but then you remove more than. So the logbook has to tell and match what the doctor ordered and the prescription and what you dispense. So what you document, because those are two things. Of course, you can keep it longer than that, but the minimum allowed time is 2 years. So that basically, remember, these controlled substances are very, very complex. So thank God I never got directly involved with this, because I just ordered something that was needed, give to the nurse, to give it to the patient. I have no access to it. So that's basically what it is. I didn't have to do this, but I knew the process. So drug references. So we have something that is called the USP and F. So what the USP stands for? The United States Pharmacopoeia. Remember, we talk about this. This is a book. This is like a directory when we have all the list of every single medication. But we're talking about controlled substances. We're not talking about the PDR, the regular, directory for medications. No, this is for these controlled substances. Of course, we have a pharmacopoeia for all screen that pops up. Here we go again. That says that I'm being put on hold. I don't know what is all this coming from. So let's see if it doesn't bother me anymore. I just changed my Wi-Fi for the other one. So hopefully it doesn't give me more troubles. Okay, so that's basically what these controlled substances are all about. Remember, we are talking about these United States Pharmacopoeia. Remember, this is a big book, like a directory, when we have a list of all the medications, but including the controlled substances. So again, we're gonna have the information there. And when you receive the medication, you're gonna have a package insert. Remember, this is the information that comes with your package. So nowadays in the United States, well, back in the days, they give you a little bag, and the medication was inside, and the insert they placed it inside. Now the inserts are stapled to the, shopping bag on the outside. So it is good idea to read it, to go over. Remember, the insert is when you have all the information about the medication, including what is the purpose of the medication, what are the side effects, what are some warnings, what are the contraindications, any allergic reactions. So that's basically what it is. What is the recommended dose? So we have to read it. Sometimes we just take the medications. We don't read, we don't bother. So again, it is very important to get familiar with, whatever we're taking, just in case, because if we develop a side effect or an allergic reaction, we are going to know. And if it says side effects, it says, oh, no, wait a minute. This is not as serious as I thought it was, but still, I'm going to call my doctor. Once again, the purpose is not just to stop the medication. Remember, when you have side effects, unless those side effects are very complex, complicated, or whatever else, then something that I don't understand. Okay, can you guys hear me?
Yes.
Okay.
Hi, hello. Hello. Hi, I cannot hear anything.
Oh my gosh. Hello. Can you guys hear me?
Yes, right now it's
Hello.
good.
Oh, I'm sorry guys, but something is going on. I believe I have to call the director tomorrow to see what's going on with Teams because it's logging me off. Said that there is a connection issue, but it's not my internet because I do have internet. So, anyways, so if this continue happening, please, stay tuned and see how we can fix this for next week. So I have two internet lines, particularly because I live overseas. Not to have any problem, never have any problem. This is the first time here with this class that I'm having some issues. Okay, so we were talking about, let me see if can you guys see the PowerPoint presentation? Oh yeah, yeah, I can see it. Okay, so once again, we're talking about references for medications. We have the United States Pharmacopoeia, remember USP, and the National Formulary. As soon as you hear National Formulary, immediately you should be thinking about, the prescription. That's basically what it is. So every single time that we have to prescribe medications to the patient, we go to the Pharmacopoeia or the National Formulary. Now, these are books that are published every 5 years, again, by the American Medical Associations. So that's basically what it is. This is like the coding books. The coding book needs to be updated every year, but this, we can use it every 3 years. Why? Because there are some medications that are discontinued. So there are medications that are add-on, so we need to keep up to date this directory or the pharmacopoeia book. So that's basically what it is. Remember the last part that we were talking about before I got this a little inconvenient was the package insert. Remember nowadays when you go to the pharmacy, they staple on the outside the inserts. So you need to just detach them and read each medication side effect, the action, what it's intended for, what are the adverse effects, what are the side effects, what are the contraindications, what are the warnings. That's basically what it is. So it's very important that we are familiar with medication, just in case something happens, as I was mentioning before, someone gets, an adverse effect. So then you know what it is, you know what to do. But this is part of, the patient's education that the medical doctor needs to give to the patients when they are discharged. If I prescribe one medication, I have to tell them, I'm going to prescribe you this medication. You got to be watching out for this. This might happen. It's not that happen to everyone, but it is common side effects for this. Well, contraindications. If you're taking this, you don't have to deal with contraindications. It's just home remedies. Do not drink this, do not eat this, do not get involved with this. If there is something you might be taking outside the prescribed medications. Because remember, these herbal medications or these supplements or home remedies can affect the potency, the effect of the medication. So that is not good. That's why medical doctors always ask if you're taking anything over the counter or, home remedies or something like that. So very important. So all is the information that you're gonna find. Drug reference and resources. So remember right here, we have the FDA because the FDA is the one that approves medications to come out on the market, right? So they have the catalog, but with all the prescriptions, all the new medications that are coming out, and some warnings for some medications. whatever updates they have, this is like news for medications. So we have to be on the lookout, not you, generally medical professionals, the ones that prescribe medication. And this information, it pops up in our computer system when we are prescribing medications. Remember, in our computer system, we have the pharmacopedia and the PDR. So whenever we are looking for a medication, if the medication has side effects, they are very prevalent, it's going to tell you if they are very allergenic, it's going to tell us. If there is any contraindication to take these medications with other medication, it's going to tell us. So it's not like we are geniuses, medical doctors. No, we just need to understand when we see something. So the software applications for these medications are very accurate. So, and very good for the safety of our patients. So that's basically how it works. You don't have to deal with this, but it's just the way that we know we just check references for medications. So drug dosage, how do we decide what is the dose recommended for this particular patient? Remember, we're going to check weight, age, and gender. Those are three things that you should keep in mind, particularly weight. But all of those three factors are playing an important role when we prescribe medications. Other things that you need to take in consideration is whether you're pregnant or lactating, meaning you're pregnant or you already have a baby and you are breastfeeding your child. Because remember, some of these medications, whatever the mother takes, whether it is pregnant or lactating, it can go on the milk. So if you're pregnant, this medication goes through the placenta, can affect the fetus. And if you're lactating, this medication can go through the milk and you can affect your baby. So that's basically what it is. Physical or emotional conditions, we have to make sure we understand the psychological state or physical state of the person that's taking the medication. Remember, if they're not stable, they might overdose themselves. They might take more than needed, or they might not take the medication. So that is basically what it is. Or they are taking these medications that can conflict with the medication that we are prescribing you. So that's basically what it is. Or you are more concerned about taking the medications for this particular psychological problem versus for a condition that is physical. So once again, a bunch of stuff that plays an important role in deciding, what dose we are going to prescribe to the patients. Again, medical conditions, certain medical conditions, we give certain medications, but then you have something else. Then the medication that we are going to give you, we have to verify that that medication is not going to have any conflict with the other medication. So we have to make some type of consensus, check other options. So basically, that's how most of the stuff works. Well, if you have an infectious disease, remember you have a microorganism that is causing you an infection, then once again, that can also change the way that we are, prescribing new medications. Remember, when you have a bacterial infection or other type of infections, we don't give you medications for a long period of time. We give you medications for few days, maybe a week, and then that's the number of medications that we're going to give you, number of pills, number of tablets, or whatever else. Nothing else. Why? Because the condition should be controlled by then with this amount. So we're not going to give you more, and we're not going to give you refills, and you shouldn't be taking more than, that the medical doctor has prescribed. That basically meaning going by yourself and getting these medications by yourself. past medical history. If this medication didn't work or was used before and didn't work and was switched, well, we're going to make sure that we're not going to go back and give you the same medication. Remember, that's what we keep medical records to see which conditions you have had or what medications you had or currently taking, because that can influence, the effect of the medication. Lots of things we have to take in consideration. So once again, if you would prescribe the same medication, probably we're not going to do it again, unless this medication worked for you. So you have an infection prior, they give you this medication, we see it on records, patient satisfaction, patient was relieved from the problem. Now we can give the same medication because it did work last time. But if the medication was switched, the medication was changed, the medication was withdrawn, whatever the case may be, well, you have to check the past medical history to see what the patient has been prescribed with. We're always going to look for the safe method to give medications, whether the route, the time, the amount, and so on and so forth. So think about it. All those things play an important role, because if I give you medication that is supposed to be intramuscular and I give it to you intravenous or topical or subcutaneously or intradermal or in a patch, in a cream, well, it's not going to work the same because it's written to be intramuscular. The opposite also works. Something that is topical cannot be given by any other route. So that is how it works. So we need to take in consideration several things before we actually prescribe medication, because that's how it works. Because medications are very dangerous when you do not administer them accordingly, based on the patient age, gender, and weight, and medical conditions. Okay, so here there is a question. What is the difference between dose? We discussed that particularly. I explained it to you, remember? A toxic dose is a medication that causes you some side effects, some adverse reactions because you give them more than you were supposed to. Now, little dose, that is something really, really serious, because that's giving you a medication that is going to kill you. So you are definitely overdosing the patient. So you're taking more, way more than you were supposed to be taking. So that's basically what it is. We're not talking about giving you a medication that is going to kill you because we just want to do that. No, it's medically speaking. So very serious. What is the difference between maintenance dose and therapeutic dose? Remember, therapeutic dose is the dose that we're going to give you to treat the particular condition that we have a precedent that this medication at this dose, based on your age, your gender, and your weight, has worked for other people. Maintenance is the continuity of the medication. Remember that therapeutic means treatment. This is not cure. This is medication that has to be given continuously because you have a chronic condition. So maintenance is to continue giving that particular therapeutic dose because that is the one that works. Remember, this is the minimum amount of the drug that can help you with the problem. Maintenance, you're going to be giving this amount for many days, months, years. So maintenance is that you continuously taking the medication because you have a chronic condition. And the only way to maintain your condition at bay is giving you the medications. Same dose every day. Now, don't take my word for it when it comes to the same dose. I'm talking about in certain conditions. because there are certain other conditions that we start you with one initial dose. It is a larger dose, and then we start taping it down until we kind of reach a plateau, and we're gonna keep you with the lowest, meaning the therapeutic dose. But those are for certain medications, so don't um don't be concerned much about that. It's just making the clarification just in case medical doctors start you with a dose that was very high or very low, and they start taping it down or increasing the dose, or can happen. But here is when the dose continues the same. Okay, so let's move on. Any questions about controlled substances? Because we are done with this chapter. Anyone? Okay, so we are going to move to the next chapter then. Let me see, where is it? Oh no, this is not. Oh, the chapter is not here. So let's remove this. And let's move to the new chapter. I hope I have opened, I thought that I have opened this chapter too. Okay, never mind. Here I'm gonna share with you the following chapter. Okay, drug source. Oh, wait a minute. Didn't we talk about this? Yeah. Oh no, I don't know what I got back to this one. Forms of drugs and how they act. This is chapter number 8, so I'm gonna share it with you because this was the next one. I don't know why. So this is how it is. Once again, some of the information in this chapter might be, my overlap, but some of the information will be new. Forms of a drug and how they act, remember. So we're going to talk about more like the physiological aspects of the drug when it enters the body and what it does as it goes through, the organs until it reaches the target organ or tissue where the effect is supposed to take place. So basic preparations: liquids, solids, semi-solids, transdermal system. So we know about liquids. Remember, our kids, mostly we give them medications in a liquid form, like Motrin, Tylenol, and some other medications. Solids, tablets, pills, that's what we call capsules. So that's basically how it works. Creams, like semi-solids, and transdermal are just the patches. That's basically what it is. These are the most common medication. There are other basic preparations, but we're not going to go through all of them. We're going to go through the ones that are more commonly used, the ones that probably you're going to encounter when you visit your medical doctor or when the patient comes to the office and you sometimes might need to reinforce some information. Ocular therapeutic systems. So now these are medications once again for vision. Implantable devices. We're going to talk about these implantable devices, something that is placed underneath the skin or the dermis to, to evaluate your glucose levels, your other things that might be necessarily to evaluate. So basically, that's how it works. So instead of, giving you an injection or medication through this particular side or route of your body. We're going to go directly through that implantable device and we're going to apply it there. So we don't have to be poking you all the time because this is mostly for people who has to give medications very often, sometimes more than once per day. Fast dissolving drug delivery system. So we're going to see how these medications, drugs, depends on the route that is given, how fast they can reach the system. That's basically what it is. Or when talking about the system is the blood flow. Remember, the medications that enters directly through the blood flow are intravenous medications. Anything else doesn't go directly through the blood flow because it starts in the muscles, the skin, or the respiratory system, and then it's got to go through all these structures of the system that is going to be used as a track to deliver these medications. So that's basically how it is. So let's see some liquid preparations. Tinctures. Now, once again, this is like, you just place on herbs into the water and you just soak them and you do some type of preparations. That's basically what it is. This is kind of home remedies, so to speak. Fluid extracts. Now, this is very similar to the tinctures, but with the difference that we are going to remove, once again, what is needed from these leaves. Remember, this is when I was talking about the sources where we get certain medications, and we talk about plants. We can use the roots, we can use the stems, we can use the fruits, we can use the flowers, we can use the leaves. But then it's got to go through a process. And that process is called fluid extracts because we are going to remove. We're not going to get everything from the preparation of the leaves or the flowers or the roots or the fruits. We're going to extract only what we need from those particular parts of the plant. That's basically what it is. We have lotions. You've probably heard about this. So these are, liquids. We have sprays. So these are medications that, you can apply through the respiratory system because that's going to be absorbed by the mucous membrane. So that's basically what it is. So just for you to have an idea, aerosols also very similar to spray, but with the difference that we're not spraying right into the nostrils or the mouth, inside the mouth, or any other locations in our body or sites. This one is exclusively done for the respiratory system. So we have like nebulizers or the MDI, which is the dose meter doses that use for people who have asthma or COPD. So there are many, many, many other, ways of, administering medications. Emulsions, elixirs, syrups, all these have some type of water base. Some others are alcohol base, and some other are just kind of very sweet solutions, meaning they come from sugar, like the syrups. So that's basically how it works. Now, your medical doctor is not going to tell you, oh, you're going to take this elixir. No, they're just going to take this medication, take it this way. That's basically what it is. You don't have to be worried about this. They will not ask you this on your exam, but just know that there are different forms in which medications come from. Solid preparations, we have capsules, gel caps, caplets, droches, tablets. Oh, so many stuff. Some of the things are not even familiar with, like the droches, never used them. But the capsule, the gel caps, and the tablets, of course. And powders, some solids. Remember that we had to kind of recombine or mix with some distilled water of sterile water before we apply, particularly certain vaccines. So in powder also can come, and it is a solid. So that's basically what it is. So we talked about this yesterday. We talk about the enteric coated medications or drugs. Remember, we talk about these drugs being protected. That's what they have, this coated layer on top to prevent the medication from damaging its cells as it passes through the stomach due to the acidity level of the stomach. Buccal, remember, that is in between the cheeks. Sublingual, underneath the tongue. And remember, one of the most common medications that is given to patients sublingually is nitroglycerin. Layered medications, these are a bunch of little layers in between, like putting one stack over other, like stack medications, one little layer over other layers. So that is to protect also the content of the medication. Score medication, remember, these are the medication that if they have this little indentation, they can be break down, they can be cut. So when it says can be cut, does not means can be crushed. That's a different issue. Chewable medications, remember, we have most of these solutions that we use for the cold, for the cough, and things like that. Effervescents, those are the ones that come solids, like a little, round, flat um, shape medications that you place in water and then, they start dissolving over there. We also have other medications, tablets like vaginal like suppositories or any other tablets that are used for certain fungal infections, bacterial infections that dissolve right inside the vaginal structure. So that's basically what it is. So here it says why would an enteric coated tablet be desirable? Remember, I already explained you. This has this extra coated shelf on top of the medication to prevent the medication from damaging from the acids of the stomach, because these are medications that are taken orally and they have to pass through the stomach. So they will be destroyed as they pass through the stomach. So for that reason, they have to be protected by this extra layer that they place on top. That's the coated part. And one of the most common medications, once again, aspirin. Semi-solid preparations. Now we have suppositories, because they are kind of, they are protected just by a little capsule, but that capsule dissolves with the body temperature and let these preparations inside dissolve through the mucous membrane. We have creams, of course. Creams are topical, something that you can apply on the surface of the body. And we have ointments. So ointments, very similar to creams, but they are more like soft. So that's basically what it is. Oh my God, these dogs are running all over the place now, making so much noise. So that's basically what it is. Probably you're familiar with creams, ointments, and some suppositories. That is very common. There are medications. So for that reason, they are used. Transdermal systems. Oh, yes, close some of the windows because these dogs are making too much noise. Oh, see. Okay. Okay, transdermal systems, patches. So these are very, very common devices, so to speak, that can be used by just applying them over the skin. So that's basically what it is. And they are going to release medications in a very small, slow. The reabsorption is going to be very slow because this transdermal, remember, trans means goes through dermal skin. So that's basically what it is. So these patches, usually that's how we generally call. So you don't tell the patient, hey, Mr. and Mrs. Smith, I'm going to apply this transdermal. No, you said this patch or patch, we're going to apply it. So that's basically what it is. So the medication is going to be there in that patch and it has to be released very slowly because it's going to be absorbed very slowly. That's the way it works because it lasts for prolonged periods of time. So that's basically how it is. So one of the things that we need to understand when we are applying these patches is that you got to clean the area, the surface of where you're going to apply the patch for the first time. You're going to clean it with alcohol, let it air dry, and then you're gonna wear gloves because remember these patches contains medications and they are absorbed transdermally. You don't want these patch medications to go through your fingers because you do not need the medication. So basically those are the steps that are needed. You need to understand when you applying a transdermal patch. A transdermal patch, when it is replaced, you should not place it in the same location. If you have it on the right upper arm, the deltoid, on the right arm, upper arm, next time you're going to place it on the left or somewhere else where the medical doctor recommends it should be placed. So that's basically how it works. So this is not something that you just gonna do like, and you gotta explain the patients as well that if they have to change this, hold on a minute because these dogs are going crazy in my home. Okay, so that's basically what you need to understand. Remember, all the instruction that we give to the patients are things that we need to know. If you don't know it, then how are you gonna explain the patient? So these are the things that you have to reinforce the information to the patient. So that's basically what it is. Do not worry about the patch itself, what it consists of, what it does. No, this is a medication that is applied over the skin on the surface of the patient. And before we apply it, we have to clean the area with alcohol. We let it dry. Then we apply it, but before we apply, we need to wear gloves because we don't want these medications from the patch to be absorbed through our fingertips. So that's basically what it's not only that you're going to get the medication that you don't need, but now, what if you're allergic to it? But it can give you some side effects because it's going to be absorbed because you're not going to wash your hands immediately. So now you're going to get the effect of the medication that it wasn't for you. And once again, if the patch needs to be changed, you cannot place the patch in the same side, in the same place. You have to move it to another location. You have to be switching locations every single time you change the patch. You have to know for how long this patch needs to be placed. So that's basically what it is. Recommendations to the patient. Whether the patient can take a shower with the patch or the patient needs to cover the patch with something to prevent them from getting wet. So you need to understand all of these regulations. So it says right there on the bottom, always wear gloves when applying or removing any patch or disc because it looks like a little disc. Sometimes they're square, sometimes they're circle or round. Because remember, you're going to get medications through your fingers. So this is very important for you because remember, transdermal, you need to understand what transdermal is through the skin and what can be used through the skin as transdermal patches. So that's basically what is important. So keep in mind most of these things that I'm telling you because these are simple things and these are things that medical assistants can do. Sometimes this because the patches are kind of very safe because you don't have to calculate medications. So it is safe that you change patch or that you apply patch. The medical doctor can just direct you how to do it, and you just have to do it right, following all the recommendations. Not about, the medication per se, but just about how the patches are placed on the patient's body and how you will, you're supposed to be taking care of yourself when you're doing this by wearing gloves, by cleaning the area, by making sure that the process is done or the procedure is done correctly. So that's basically what it is. I'm not concerned about anything else because you will not be asked whether the patch has a reservoir, whether it is impermeable or anything else. No, it is the release is going to be very slow, so it is absorbed very slowly because it goes, think about this, it goes from the skin, from the surface of the skin. Now it goes through all the layers of the skin to the muscle, to the blood vessels, then enters the system, which is the blood flow. So it's got to be a long process to go there. Now, if you give a medication intramuscular, it goes directly into the muscle, from the muscle to the blood vessels. It's a very short distance. If you gave a medication intravenous, you're placing it right through the system. So these medications depends of how you want them to be absorbed, how the release of the drug needs to be done, whether it's going to be slow or kind of in the middle or fast. We need to find the route. That is the purpose of the medications, because not every single medication works giving the medication in the same route. There are oral medications that you cannot give them in any other form. There are IV medications that you cannot give them in any other form. The same is inhalants or sprays that are absorbed directly through the mucous membrane, or aerosols that goes through the respiratory tract to the lungs and then send it to the blood. So that is how it works. So transdermal, remember, through the skin. And through the skin, the medications that we usually use are patches. So that is the key for this transdermal system. Other delivery systems, ocular therapy systems. So remember, we talked about that in a prior chapter when we apply we distill some medications or instill some medications on the patient's lower eyelid. So that's basically what it is. It has to be done right there on that sac of the eyelid, not place it directly on the eyeball or the cornea. That's not how it works. So no worries what the medication is for. What you need to understand is how it is applied. Because if you don't apply these medications correctly, if you don't use the correct route to get the medication simply not gonna work. So that's basically how it is. Implantable devices, well, that's what we mentioned at the beginning. So that is a device that is placed or implanted underneath the skin. So things that we have, for instance, insulin. Remember, I talked about to check glucose levels. So instead of, giving you insulin, um, subcutaneously pinching your skin so many times, because this is something that you have to do maybe once, twice, 3 times per day. Where else you're gonna find a place to place it over your abdominal area or your thigh? As time goes by, you're gonna run out sides. So they're gonna implant something that you can just apply the insulin through that device. Think about this IV fluids line. They're gonna give you IV fluids, but you're gonna be hospitalized for several days or more. Well, we keep the IV line in place just in case we need to give you more medications, more fluids. We don't have to poke you again. So we leave that IV line right there. Or for someone who's getting chemotherapy, we're going to place a shunt right there. So every single time that you come, they're going to use that portal, that implanted device to give you the medication. Same goes for patients who are getting dialysis. We don't have to be kind of jogging around the patient veins to find a suitable vein because you are in really, really bad shape. Probably your veins no longer are going to be suitable to place a needle there and give or a cannula so we can do this cleaning of your blood with a dialyzer. So we place a shunt right there. So every single time that you come, the device is implanted there. So that's basically how it is. Fast dissolving drug delivery system. So now this is once again medications that can dissolve very easily or rapidly in saliva or any other sources. Very common use in pediatrics, geriatrics, and patients that are, bedbound or mentally disabled. Remember, some patients cannot follow directions. Very difficult to give injections. So we are going to give them a medication in a form that it can be easily, absorbed without having many inconvenience. So that's basically what it is. So you won't have questions from here. It's just for you to know there are many, many ways of delivering medications to the patient. In other words, administering medications to patients. There are so many, and you see now how complex this is, and that is the reason that we have nurses, someone who specializes only on dealing with medications, because that's what they do 95% of the time. So that's basically how it works. Injectable routes. Now we have intradermal, subcutaneous, intramuscular, intravenous, intraarticular, intra, many ways. But remember, these are injectable, meaning we are going to be using needles. I'm not talking about anything else. Intradermal, right underneath the skin, the epidermis. It's not even the skin because the skin has 3 layers. It's under the first layer of the skin, the most superficial one. That is called intradermal. Subcutaneous, that is the third layer of the skin, the fat tissue. So for these reasons, we have to have certain angles in which we are going to be administering this medication. If we do not use these particular angles when we are administering these medications, then the medication is not going to go to the right tissue. So in other words, it's not going to work. So that's basically what it is. We will have later on all these angles because you need to know the angle that you're going to use from intradermal when you're giving medications. Subcutaneous, remember subcutaneous means fat tissue is going to the fat tissue. Intramuscular, this means that goes directly into the muscle. Intravenous goes inside a vein. Intra-articular, it goes inside articulations or the joints. You don't do any of these. You might be allowed to do intradermal, particularly the TB test, if somebody trains you, because it's a very, very simple test to do, but it is very simple, but at the same time, it's a little kind of tedious because sometimes you don't know if you went exactly underneath the epidermis or not. Because if you don't do it right underneath the epidermis, medication is not going to work. Medication don't work if it's not given correctly in the route that is expected to do. So that's basically what it is. Now it says right there, question, why would an implantable device be chosen over other routes of administration? Remember, I told you already. Because we don't need to be poking the patient all the time. The patient might not have a suitable site or vein or whatever site that we need to administer the medication because it's being given very frequently. So it's going to damage the tissue. And we're not going to be able to do it. So we implant a device. So that's basically what it is. Now, what will be one of the reasons? The question will be, what will be one of the consequences of having an implantable device? What will be a problem for it? Infection. Because this is a foreign body that you are, implanting right underneath the skin. So within time, you're going to develop infection because there is a port of entry right there. So you have to clean it. Sometimes you have to move it from the side, but every certain period of time, because it might not be viable or patent to do it. So that will be one of the things that we should be discussing. But once again, I already explained you this. Very important to understand. Actions of a drug. Any questions? So it says right there that the drugs are grouped in 3 ways. Act directly on one or more body tissue. Act on invading microorganisms. Replace body secretions. So the actions of the medication depends on what medication is given, depending on what condition the patient has. If it has a microorganism, meaning an infection. So then whatever the medication you're going to use, whether it's antibiotic, antiviral, antifungal, or antiparasitic, is going to act by killing that particular microorganism. Or if you have a damaged cell that is a cancer cell and you're taking chemotherapy, well, that chemotherapy is going to act only on those bad cells. Those cancer cells is going to eliminate them, just like antibiotics do. But these are precancer cells. Or it can act in different muscles of organs or even systems. Or if you have a deficiency of a hormone or any other vitamins or minerals, now we can replace them. Remember, replacing means you're not having it, you're not getting it, your body's not producing it, you're not eating it in your diet, you're not having supplements. We are going to give it to you, whether, as a supplement or whether we're going to inject it to you. So that's basically what it means. So all depends. Selective action. Now, once again, some of them is how they work. Stimulants. So stimulants, mostly, they kind of increase the activity of the cells. So remember, there are certain things that, like caffeine, nicotine, they increase the level of activity. Now, alcohol, on the other hand, it doesn't increase, it decreases because it's a downer. So don't think that. But there are other, illegal drugs, and that's why we talk about drugs that can increase the cell activity. They give you like this rush, something like that. So once again, that is how it works. Now we have the presence, because something that pull you up, something that pull you down, decrease cell activity, morphine, and other medication that suppresses the nervous system. Alcohol is one of them. Remember, when you take alcohol, it's kind of numb you. Like you feel like you are unstoppable. You know, if you are very shy, you kind of, now you start being outspoken. But you just need the drug at this moment for you to do that. So that's basically what it is. Those are types of selective actions, different things for certain medications. Okay, this is more like chemistry, agonist and antagonist. So agonist medications are those medications that have a response directly with the receptors of the target cells. So meaning these have a positive effect. That's basically what it is. It has a positive effect. It's like they find a match when they encounter the receptors. So that's basically what it is. So a medication that it is an agonist, just think this way, in simple terms, has a positive effect. Antagonist, on the other hand, has a negative effect, because an antagonist is someone who is against. So if you have a medication and this medication, it is, you've been given a medication and this medication is an antagonist medication to another medication that you're already taking, means that this medication is going to block the effect of the other medication. Or vice versa. I'm taking this particular medication. Now the medical doctor that I saw today gave me another medication, but they didn't bother to check whether, this medication can be an antagonist to the medication that I was taking. So now you give me medication for something that I have now, that I developed lately, but what about the medication that I was taking before? This medication is going to antagonize that one. It's going to block the action, the effectiveness. That is basically what is called an antagonist. An antagonist is something that it is against. So if you are against me, you are an antagonist. If you are against abortion, you are an antagonist to abortion or to anything that you are against. So that is antagonist. But in medications, it's something that's against something else that you're taking. It can be the one that you're taking now that is going to antagonize the one that I'm just taking before, or vice versa. The one that I was taking before is antagonizing the one that I'm taking now. So in other words, this medication is not going to work. The one that is antagonizing the other one is blocking it. It's blocking its effect, so it's not going to work. Whereas agonist is the one that works with no problem. So that's basically what it is. Local action. So think about this. Local action, we talk about this, is going to act directly in that particular site where the medication was administered or applied. So let's say that you have a cream, an ointment, and you apply it right on top of that rash that you have, or some little scratch or some little lesions. It's gonna act right there. It's not gonna go anywhere. Now, remote action. So this is also called transfer action, meaning it is applied here, but it's not applied there. It's gonna be going somewhere else, but not to the flow. That is basically the difference. So there are some medications. Oh, I have problem in this particular leg zone. They're gonna place the medication on my arm. Well, it's not my arm that it hurts. It is my leg. But it's gonna go there. Now, systemic. Systemic means it's gonna go to the blood flow. Every systemic medication needs to pass through the blood flow. And it goes through the blood flow, and the blood flow distributes this medication to whatever tissue, organ, system needs to be delivered. So that's how it works. So things that you need to know, local and systemic. So when they mention that there is a systemic medication, think about goes directly through the blood flow or bloodstream. Period. That's systemic. Local. Oh, think about that. Local means right on that particular area where the medication is applied. They're not going to ask you about remote action or transfer or displace action. No. It is these two that you need to keep it in mind, just in case, because that will be possible. Because it's simple, specific, synergistic. Well, specific means it works on that particular organ, tissue, system that, well, the medication was intended to go to. That's basically what it is. So I'm giving you this for your headache. I'm giving you this for your stomach. I'm giving you this for your heart. I'm giving you this for your liver, your kidney. It goes just to that particular tissue, organ, or else. Now, synergistic is totally different. Synergistic is when you have to have more than one drug that is going to do the same effect if you have one, because one doesn't work by itself. So you have to add more than one medication. So that's basically what it is. So think about synergy. So medications that are synergistic. Think about this because we take it very, very often. Tylenol, naproxen, all these anti-inflammatory medications. Why? Because say if you take Tylenol, it's going to be good for pain, fever. Two drugs needs to be there in order to have the effect of the things that you have. Because if you have pain or you have fever or you have swelling, now you have to take other medications. Oh, now you have to take Motrin, Aleve, or any other medications that are considered anti-inflammatory medications. Why? Because they work for inflammation, for pain, for fever. So you have a lot of stuff going on. Some other medications they give you for cough, they give you for, to release all this phlegm. So those are synergistic medications. So you need more than one drug in order for you to have, the effect that is desirable. It says right there, potentiates action of another drug. Now, that is synergism. You get certain medications together to potentiate the effect because one drug by itself is not going to do. So you need more than one. Now, synergistic also means that if I'm taking this particular medication for this condition, now I develop another condition and my medical doctor ordered another medication. Didn't check what medication I was taking. And this medication actually increases the potency of the medication that I'm taking. That is synergistic as well. But that's not good because that can be toxicity level for me. I'm taking this medication, this dose, that's the highest dose that I can take. Now you gave me another medication that is going to increase the potency of this other medication that I was taking. Well, think about this. You have two or more medications that increases the potency of the medication. That is not good. So it can be a negative part, it can be a positive part. It can be that I need a medication that has more than one function, so to speak, or action, so it can fix all the problems that I have. You don't want to take medication for fever, one medication. For pain, another medication. For swelling, another medication. No, you have one medication that has all of them. That's synergetic. But also you can have only medication that is only for one thing, but it can affect another drug that I'm taking already. So that's basically how it works. So the medical doctors needs to evaluate what medications, what history the patient have prior to prescribing a medication. Because that is the reason probably that now you're having an adverse effect or a toxicity level. Not to mention, God forbid it, a lethal level. So that's basically what it is. So again, that's how it works. Any questions? It says right here, question, what types of drugs decreases cell activity? So one decreases. Remember, the patches are slow absorption. But if they ask us which ones blocks or antagonizes, which probably is what they're asking, then you're going to say antagonists. So that's how actually works. So pay attention to synergistic medications or actions, antagonists, because chances are you might encounter this on your exam. Okay, so let's take a break. We're gonna go on break. We're gonna come back at 7:40, and when we come back, we're gonna finish up this, and we're gonna start another chapter. So that's basically what it is, because it's been already some time, we need to take a break. All right, so get some rest. See you again 7:40. Okay, thank you. See you then.
Thank you.
You're welcome. See you. Okay, so we are back. I hope you guys enjoy your break. Let's continue with this chapter, almost done. Few slides that we have. So let's see. Okay. So let's talk about these factors that affect the drug action. Remember, there are many things that we have to take in consideration when we administer a medication or when the medical doctor decide to prescribe a medication. The absorption level of the medication, where it's going to be absorbed. So that's basically what it is. Remember, we have different routes. We have topical, we have through the mucous membrane, inhalants, we have through under the skin, we have intramuscular, intravenous, subcutaneous, intradermal, as transdermal, many routes. So each route has a different absorption rate. When we give a medication, we got to make sure that the medication is going to be administered slowly or a little faster or faster. So that's basically what it is. Another factor, distribution, how this medication is going to be distributed. So in other words, how long it's going to take to get to the target site. So that's basically what it is. Biotransformation. Biotransformation means these medications, when they enter the body, they are inactive. They are inactive. They are not active, inactive. When they are metabolized, whether by the liver or by the kidneys, now it's going to be active. That's called biotransformation. Elimination. It did whatever effect did to the target site. Now, whatever excess or wastes from this medication needs to be removed. So that's why when we check the blood levels, the urine levels of the patient, we see traces of medication. Why? Because if the medication was completely absorbed or not absorbed or was accumulated, we are going to see residuals or not. So that is the most important thing. So when someone is taking a medication, think about this just in a simple way. When we apply for a job, some of the organizations, they want us to have a drug test. So think about, these are drugs, medication, drugs, whatever it is, but it's giving you an example so you can understand. So they do it through the blood. So they're going to collect your blood or they're going to collect your urine. Because if you have ingested that medication or that drug in particular, we're going to have some residuals that medication was ingested. Why? Because we have some particles of the medication that is going to be eliminated, even though if it is the waste, but the waste is going to show what drug was it. And if you have too much of the drug, certain levels of toxicity, then you're going to see more. Think about alcohol. When they stop you, you're driving, and the police just stop you and suspect that you might be driving under the influence. They do a breath test, and then they can take you to the prison, and they can do a blood test. Because they're going to check for drugs, because the residuals are going to be there. If it is already acting up, it is active because the biotransformation has already occurred. They're going to cut what medication is instantly and how much of the medication is being ingested. The other one is going to be residuals that you actually have the medication, even though if the medication right now is not in the system. There are certain medications that we can, let's say that you took this drug. 24 hours later, the body gets rid of it. Some others, 24 hours later, 72 hours later, a week later, 1 month later, you haven't done anything, but 1 month later still can show in the urine or the blood, whatever the case may be. So that is basically what it is. So medications are absorbed differently depending on the medication, depending how fast you want the medication to reach the target organ. Remember, distribution means how it moves from one place to the next, from one tissue to the other, or how the medication is distributed through the blood system to reach different organs, how it's delivered. So that is basically what it is. Remember, every single medication, when it enters the body, enters in a form that it is inactive, and then has to go through the liver or the kidneys, and that is the place when it's going to be metabolized, biotransformed. Now it's no longer active. Think about, you have an egg, right? An egg is inactive. When it becomes active, when you break the shell and when you prepare the egg, or when you release whatever content it is inside. That is the medication. The medication enters like an egg, goes to the blood flow, enters the liver because it's going to be biotransformed there, or it's going to be activated. So what it does in the liver is break the shell, remove whatever content is inside, now release it to the blood flow, now it's active. So if it is not activated, these drugs are not going to do anything. Think about the egg, just simple as that. The eggs keep on flowing through the blood flow. It is covered by the shell, so it's not going to do anything. So that's basically what's going on. So all these factors affects the drug action. If it's not distributed correctly, it's not absorbed correctly, if it is not, activated, which is biotransformation, or if it's not eliminated, because it has to be eliminated. Think about you eating and eating and eating, and you do not remove all these wastes from your body. Well, that's going to be complicated, right? So that's not good. You're going to die. Well, if you have all these accumulation of the medication, you're going to die. If the medication is not absorbed correctly, your complication is going to get worse, Brody. You're going to die. If the distribution doesn't reach the point of the target where the medication needs to do its effect, you're not going to get fixed. So you're going to worse, your condition is going to worsen. And if the medication is not going to be activated, this is the same. So all these factors, affect the drug action. So in a negative way, if it's not done correctly. Side effects. Remember, we talked about side effects already. So we're not going to kind of spend too much time. So this is an undesired effect. So that's basically what it is. It is an action or a, something that it was not supposed to happen. So that's basically what it is. And if you have a side effect, it might be the chances that you're not going to take the medication, that you're going to stop the medication, because nobody wants to have side effects, particularly if the side effects are very bothersome. Adverse reaction. Once again, this is similar, or you can use these terms interchangeably. I use them interchangeably. Many of the medical doctors use it. So it says there, unfavorable or harmful unintended action. Well, see, action other than intended. Well, here an adverse reaction is something that happens to your body that you weren't expecting. That's basically what it is. Now, the problem here might stem where, more than the medication was given, the dose was larger than supposed to, or it was interacting, synergizing with another medication because the medical doctor did not pay attention to other medication that the patient was taking. So that's basically how it is. All these unwanted side effects from medications or adverse reactions are reported to the FDA. Why? Because they're going to, to take notes. And if this is reported several times from different patients, now they're going to see that probably this is something that they didn't know was going to happen. But remember, when the pharmaceutical company is manufacturing that medication, you're not going to see all the side effects because you have certain volunteers, certain people that you're going to try the medication with. But as the medication becomes more used, more popular, and different people with different conditions start using it, more side effects and adverse reactions might happen. So it needs to be reported so they can document it and they can add it to the pharmacopoeia and the insert that you receive for the medication. That's how it works. So kind of they update the information. That's how it is. Drug interactions potentiates and diminishes. Now, potentiates means that increases the level of the potency of the medication or the effect of the medication. Remember, this is like synergies. It's the same thing. We can use this interchangeably, but we don't use the word potentiates directly. We use synergies. But potentiates means, once again, that increases the effect or the action of another drug. You're taking one medication and that is going to increase the action or the effect on another drug. That is not good. Remember, increasing something is not good because you've been given a dose. Now you're taking something else and it's increasing the prior dose that you were given. You're not supposed to be taking more or less, or whatever was already prescribed. So that's basically what it is. Another interaction might be that diminishes, in other words, decreases the effect of another drug. So we have to be very careful with medications that are given for different conditions while the patient is taking other medications. Remember, that's one of the reasons why medical doctors are the only ones to prescribe medications, not nurses. Remember, physician's assistant, they are the level of the medical doctors. Nurse practitioners are the level of the doctors. Dentists, well, they are doctors. So they prescribe. No one else can prescribe medications. So that basically, you have to be a medical doctor or a physician's associate or a nurse practitioner. Besides those, no one else can prescribe medication. So just think about it. Because those are simple questions for exams. Which of the following things medical assistants can do? Well, you can do vital signs, you can register the patients, you can assist the medical doctor doing something, but forget about medications, regardless of what it is. Don't answer medication. Don't answer advising the patient. Don't answer diagnosing the patients. None of those. So that's basically, remember, medical assistant. You're assisting the medical doctor, not doing the job of the doctor. Okay, any questions before we move to another chapter that we're going to cover today? All right, so let's move from here. Okay, so let's select the other chapter. The medication order. So think about this. Somebody has to order the medication, somebody has to prescribe the medication, somebody has to dispense the medication, somebody has to administer the medication. So that is exactly what we are going to talk about here. Key terms, the agent. The agent is the person that prescribes. We're going to see it later on. Compounding, we're going to see it later on. But this means putting together a bunch of chemicals to produce a medication, a drug. Because remember, a drug is not just one thing. There is a mixing or combination of different chemicals. It's not just one. If prescribing, well, that's the new technology that you use to prescribe medications to the patient. We do it directly from the computer, not the way that we used to do it, through a prescription pad. Pharmacists, of course, is related to pharmacology because these are the people who manufacture these medications. Particularly in this case, they are the ones that are doing the compounding. They do not produce the medication. The medication is produced by the pharmaceutical company. But the pharmaceutical company distributes all the compounds, all the chemicals needed, because you have the formula, so they just gonna give you all the ingredients, so to speak. So that's basically what it is. So pharmacists do not create the medications directly. They receive the formula. Think about chef. I give you the what's called I give you the instructions to prepare something, and then you're gonna do it because you're a chef. So you just put all the ingredients to produce the particular dish. So that's what the pharmacy is. They just put the appropriate chemicals to get this, just following the formula. That's it, to get this particular medication. The medication order. Now, the medication order is given for a particular patient or specific patient. So that's basically what it is. And who is writing this prescription? A physician or an authorized prescriber. Remember, things have changed because back in the days, only physicians, which is an MD, a medical doctor, they were the only ones that could prescribe medications. Not anymore, because now we have physicians associated and nurse practitioners. They also prescribe medications. So that's why we don't say always, oh, the medical provider or the physician, because back in the days, everything was the physician or the medical doctor. Because now there are other practitioners that are not actually physician, medical doctors, but they have a title that is kind of reciprocal to whatever the medical doctors are doing. Must be illegible and complete. Now, the order must be illegible and complete. Has to have all the information pertaining to the patient, the medication. So that's basically what it is. Because if it's not legible, we're not going to be able to read it. I don't know how many of you still remember when medical doctors gave the written prescription that we couldn't understand anything. It's very difficult to kind of translate whatever the medical doctor has written on those medication pads or prescription pads. And it causes lots of problems because people sometimes mix up the medications because there are some medications that sounds alike. They are written almost the same because of the same family, the same classification of drugs. Sometimes it was misinterpreted, so whether by the pharmacy or by the nurse that was ordered to give the medication, it creates lots of problems. So legibility is a very important topic, and that's why now we have electrical prescription, just like electronic medical records. Remember, back in the days, we have paper-based medical records. Who understands the handwriting of the medical doctors? To be honest with you, I have trouble trying to understand somebody else's handwriting. So I have to verify, I have to make sure that, I have the right information, and I'm a medical doctor, but that doesn't imply that I have to understand whatever you wrote on that document. So sometimes it's a little difficult, not because they're not using the correct medical terms. It's not that, it's that, how they write it. And it was the purpose of that. The reason why people were writing like, medical doctors do is because back in the days, remember, these medical records and everything that the medical doctor did was based on the medical doctor. It was centered on the medical providers, not the patient. Now it is centered to the patient. The patient is the priority. The patient needs to know. The patient needs to understand. The patient needs to agree or disagree with whatever the medical doctor decides. Back in the days, it wasn't the case. Whatever the medical doctor asks you to do, you have to do it. You couldn't confront your medical doctor. You couldn't tell your doctor, no, I don't want that. Oh, no, you're going to do it. That was like your dad telling the child, you do it or you do it. Not anymore. Now it's patient-centered care. Now it's focused on the patient, not the medical provider. These things have changed a lot. And that's why now we have electronic medical records, because now we can understand. It's printed. Anyone can understand. Even though if you're not medical related, you understand what it's saying right there because it's written in plain English. If that's the case in the US or the language of any country. So that's basically what it is. And it has to be complete. All the information of the medication, the patient needs to be there. Because if something is missing, can you imagine you have a prescription, but you don't have the patient's name? Oh, that's not good. You have the patient's name, but you don't have the dose. Oh, that's not good. You don't have the name of the medication. The medical doctor didn't tell you what is the route that you're supposed to be giving this medication. So all those things are crucial for us to actually get the job done and correctly. So that's basically what it is. Full name of the patient, we just mentioned that. When we say full name is first name, last name, and date of birth. So that is relative because when we identify the patient, it's a different issue. But we should have the date of birth of the patient. Every single prescription should have it. Definitely. We can have the same patient, this patient with the same name, last name as someone else. But the date of birth is the difference. Name of the medication, of course. Now that medication can be generic or can be brand. Remember, generic medications are recognized because they are below the brand. If they are generic, they're going to be on top. If they are the second option, remember, there's always going to be the two names of the medication. Let's say that the medical doctor prescribes ibuprofen, which is Motrin, but the doctor prescribes ibuprofen. So you're going to see ibuprofen on top. Underneath, you're going to be seeing Motrin. The medical doctor prescribes Tylenol. Oh, it's going to say Tylenol on top. On the bottom, it's going to be saying acetaminophen. We always going to have the brand and the tray, but the one on top is the one that was prescribed. The other one is the generic, is how it's known also. The name on top is the one that the medical doctor prescribed, but always going to have the two names. Generic names always starts with a lowercase. Brand or trade, capital letter. So that's basically how it is. So I'm gonna just change it right here, just for you to understand. Brand. See, when you see brand that is being prescribed, it starts the medical, for instance, Tylenol, T, capitalized. But if it is the generic that the medical doctor prescribed, that is going to be on top, all the name is going to be acetaminophen. So it's going to be in lowercase. So that's how we distinguish between generic names, because you see the name of the medication, but you don't know if it is generic or brand. It's not that you're going to say, oh, generic, brand, or trade. No, they just give Tylenol, and then on the bottom it says acetaminophen. Or acetaminophen on top, because that's the one that they prescribe, Tylenol underneath. But Tylenol always going to have capital letters. T is going to be capital. Whereas acetaminophen, A is going to be lowercase because it's generic. So if you receive a medication that is generic, you're going to see that is a lowercase. That is basically what I'm trying to tell you. All of them are lowercase. So that's how I know, because you don't know the medication. This is a medication that you have never taken, never heard of it. Then you go look at it. So go look at your medications and you will see. If you're taking a generic, that medication starts with a lowercase. If it is brand or trade, it's going to start with a capital letter. Even though if you don't know what medication is that, but you know, oh, they gave me generic. Look at this, I have generic. Or actually they gave me the brand or the trade name. So those things are very important for you to know. Because when the patient comes and says, oh, they give me this generic medication and I don't want that. Can I see the medical doctor? I want this medication to be changed, to be switched for another one because this is not good. So you're not going to argue with the patient. Said, sure, no problem. Do you have the prescription? Or do you have the bottle of the medication? Then you just discreetly kind of look at the bottle and you said, oh yeah, this is the generic. You're not going to open your mouth. You just want to confirm what I'm telling you. Or if the patient is wrong, you can tell the patient, oh, by the way, this is the brand that you take in Miss or Mr. Smith. No, you don't know anything. Sure, not a problem. But you're actually taking the brand right now. This no, or you don't tell brand. It says, this is not generic, Mr. or Mrs. Smith. If they don't want to believe it, says, anyways, you're going to be seeing the doctor, okay? In a nice way. But you know, you identify, sometimes we can solve the problem. But once again, patient wants to see the doctor. Dose and route. Of course, you need to know what it says the amount of the medication has to be taken and how this medication needs to be taken or administered. The route. So we have all that information. Frequency of administration. Now, how many pills you're going to be taking? Daily or every other day or in the morning, in the evening, before meals, after meals. So that's basically what it is. And the prescription also needs to mention the amount of pills that you take for that condition per month. If you're taking once per day, it's going to be 30. Whether they have refills or not. So all that information is going to be in a prescription pad. Day and time that was written, of course, all this information should be on top. Why? Because that's where the name of the patient, the day of birth, the day that the prescription was written, and the time. Specific directions for administration. Remember, I told you this medication is supposed to be taken before meals, after meals, empty stomach, before you go bed, right after waking up. So that's basically what it is. We need to have all this information because the patient needs to follow this information. Without all this information, the patient can just complain that the medication didn't work or that they got a level of toxicity because it was not explained, it was not written correctly, or information was missing. So we have to place every single thing. Last but not least, signature of the medical provider or the person who is, prescribing the medication. Without the signature of that prescription, the pharmacy is not going to dispense the medication. Believe me. So that's how it has to do. Any questions about the information that should be contained within a prescription order? Because remember, very important. Legibility. Remember, if this prescription order is not legible, now the pharmacist is not going to dispense this medication. It says right there, if illegible, unclear, or incomplete, any information that is missing from the prescription pad, or we don't understand what medication or what dose, what route, not that it's missing, it's just that we don't understand what it's saying, will not be carried out, meaning it will not be dispensed. What is it that the pharmacist is going to do? They're going to contact the medical doctor, not the medical assistant, the medical doctor. And the medical doctor whose name is on that prescription pad, not any other doctor. So I have issues sometimes in the emergency because one of the doctors was taking care of one of the patients, and then somebody else asked me about this particular patient condition, this particular patient prescription or medication orders. Just because I'm a doctor does not imply that I have to go give orders from someone else's patient. I don't. Nobody does that. I don't know what the other doctor finds out. I don't know what your patient have. I don't know anything. I just see them running around just like I do. When the patient calls in asking for a prescription refill, you do not tell any of the doctors, there is a patient right here, needs to talk to you. That's not how it works. You get the information. Remember when we talk about communication with the patients, answering the calls in the front desk? You don't just hand the phone or transfer the call to the medical doctor immediately. No, you find out who is it, who's calling, and what is the reason. And if you can solve that, instead of passing the phone call, because that's not one of the reasons to pass the phone call to the medical doctor. Now the patient is saying that they're having an allergic reaction, that they're having a chest pain. That's a different issue. But to ask for a medication refill or something like that, you do not. So I encountered this situation because I have these medical assistants. Oh, someone is on the line and they want a medication refill. Who is the person? I don't know. Oh, seriously. You have to get all the information from the patient. And then you direct this to someone who can help. Now, in the emergency, I have nurses approaching me. Oh, can you write this order because the doctor who was seeing the patient, he's not here at this moment, he's on break or something like that, because I need to give this to that. No, I'm not going to give no prescription to anyone. That's not my patient. I'm not the one who's evaluating the patient. I'm not. So don't ask any doctor to fill a prescription or to solve any questions about somebody else's patient, because you have to direct these calls, these inquiries directly to the medical doctor that is taking care of that particular patient, not some other doctor. That doesn't work that way. So that's basically what it is. In these cases, when the prescriptions are incomplete, they are not clear, they are illegible, what is it that has to do? Has to be written again. You cannot correct anything on the prescription pad. No, you have to write another prescription. And this time has to be clear. That's basically what it is. Now it says right there, prescriber or covering provider will be contacted. Now the covering provider usually do not solve this problem. The covering provider is contacted, but the covering provider is going to contact the prescriber. So that's basically what it is. So don't expect some other doctor to, solve the problem, because that's not of our concern. But you're a doctor, you're supposed to. No. That's not an excuse. That is wrong. Remember that I told you that if someone else's write a note for the patient, collect some information, and they ask you to initial it, are you going to initial it? Or you didn't do it, why are you going to initial it? What if something was wrong? Now you're going to be responsible. I'm not going to sign anything that I did not do. I'm not going to sign anything if that's not my patient. Each doctor is responsible for their own patients, period. No question. So address the person that actually it is the medical provider of the patient. So for that reason, you have to have all the information from the patient first, and the reason why the patient is there or patient is calling. Acceptable versus unacceptable abbreviations. In pharmacology, particularly for medications, there are lots of errors that we can dive in if we do not follow these acceptable abbreviations. So there is one booklet in medicine for the nurses, for the medical doctors, which is the unacceptable abbreviations. Abbreviations that should not be used when you're writing anything in the medical records, including prescriptions. Acceptable abbreviations, MCG. MCG means micrograms. Units. You should not write U. The letter U, a capital U, back in the days was used. But U was confused with other abbreviations for other things. So whenever you're going to write down in units, because medications can be given in units, grams, milligrams, micrograms, milliliters, microliters, and units. So whenever it is units, the ones that the medical doctor wants you to administer to the patient, you have to write the whole word. Units, not the letter U. days or doses acceptable. Leading zero before decimal. In other words, this is what they're trying to tell you. I'm going to write it down. You cannot just place here period 6 milligrams. You cannot do this. That's unacceptable. Why? Because this period, probably I don't see it. The decimal, I don't see it. And, mistake, I give my patient 6 milligrams. Wow. 6 milligrams is totally different from 0.6 milligrams. I'm going to overdose my client. Probably going to kill it. So instead, you have to place a 0 prior, because I can see the 0. Oh, wait a minute, 0.6 milligrams. So you should not be using just a decimal and then the numbers following that. You have to place a leading 0 prior. So that's how it works. So it's very, very dangerous to do this. Of course, there are many other acceptable abbreviations. Unacceptable abbreviations. We have do not use abbreviations. Tons of them. Back in the days, we were using a lot of abbreviations, and they were wrong. NG for micrograms. See? MCG means micrograms, but anyone can get micrograms. So it can be misunderstood. This means milligrams from micrograms. See, remember, U or U for units. We don't use that. D or D for doses. We don't use that, because D means many things, and it's not one of the acceptable abbreviations. Nowadays, when we write a prescription, we have to spell out. Back in the days was take 1 tablet per day. Just number 1 day. Wait a minute. That's a mistake. Now we have to actually spell out 1 tablet, 1, spell it out, not the number, per day. You have to write it down, spell out every single word, so we don't have mistakes. So that's basically what it is. Back in the days, we were doing a lot of things like this. This is 1 tablet. This is 2 tablets. This is 3 tablets. And so on and so forth. So some of those things no longer use. Now we use 1, O-N-E, tab, per day. Everything is spelled out. There is no way you're going to make a mistake if you see all this information written down, spelled out, without using certain abbreviations that can be confused with something else. So that's basically what it is. Because some of those abbreviations were invented as a shorthand for the medical providers. Oh, no, this word is too long. Oh, this word takes too long for me to write it down. I'm just going to simplify it. It's kind of shorthand. We do that. Think about this new population that, when you send a text message, you just send pieces of the information. Sometimes I was looking up, my son sent me a text message and sent me little pieces of information. I was like, what is that? I couldn't understand. I said, hey, English. Well, you know what his answer was. I'm not gonna say it. Well, it wasn't a bad word, but it says, ha. See, you have to learn. See, that's what happened to all people. Can you imagine? Well, he got in trouble for that. So again, we need to spell it out because this is a serious matter. Remember, this is something that's going to go in your body if it's done wrongly because of mistakes. The patient is in trouble, we are in trouble. That's it. That's how it works. Any questions about these prescriptions and abbreviations? There's one abbreviation that I think someone told me, think about for you, for your exam. It was CC. So this abbreviation is not acceptable. So just keep it down just in case, or write it down or something, CC. CC by itself, like no decimals or periods in between. And it is lowercase, both of them. So something like that. Someone told me that they saw an abbreviation that was not supposed to be used. And they, well, couldn't recall everything, but I recall someone saying that because, you know, some of my students told me. So think about that. Prescriptions. Well, that's what we've been talking all the time. What is a prescription? Is a legal document. Anything that involves the patient, anything that involves the medical doctor, writing down something and putting their signature in the license there, that is a legal document. And remember, if you have bad, outcome because of the medications, that comes back to us. So that might go into litigation, in other words, a lawsuit, negligence. So until they proven otherwise, they're going to give us a lot of trouble. Directions. So this prescription needs some directions. I'm talking about the medication itself. This is an order. The medical doctor orders the medication. So then the directions for this is the compounding. Remember, the compounding is nothing else that the mixing of all these chemicals to produce the medication. That is the simplest way that I can tell you. In other words, putting all the ingredients together, that is compounding. That's what pharmacists do, not what the pharmaceutical company, when they were creating the manufacturing the medication, did. No, now I'm giving you the recipe. That's it. Hey, this is the recipe. You have all the compounds right there, all the chemicals, I'm sorry. So just put it together, mix them up, get the medication and the dose. That's what the medical doctor ordered. Dispensing, remember, dispensing is preparing this medication and delivering this medication to whoever, the prescription was ordered to the patient, of course, and with instructions how to take the medication. And if it is to the nurse, how to administer the medication. If it is the patient, also how to take it. So administering or administration means direct application of this particular medication. Once again, following all these 6 or 7 rights because they add another right to the medication administration. Right patient, right dose, right route, right, did I say medication? No, right medication, right documentation, so right technique, so a bunch of rights that you have to follow. We will go through that. So that is the administration part. So it's very important that when the medical doctor prescribes the medication, remember the patient do not know all the process of this medication before they receive it. But it goes through all these processes. That's basically how it works. So we are in the hands of the pharmacist and the medical doctor. The medical doctor orders the medication. If the pharmacy receives that medication's name dose, then that's exactly what they're going to prepare. So two main types of drugs, prescription drugs and over-the-counter drugs. So what is a prescription drug? A medication or a drug that needs a prescription from the medical provider. So that's basically what it is. Has to be written by the medical doctor. Other than that, the pharmacy is not going to dispense the medication to you. Over-the-counter medication, these are medications that do not need a prescription. Now, why medication need a prescription? Because these medications have the potential to cause something serious if it's not prescribed correctly, if it's not taken correctly. If you don't follow all the instructions as prescribed. Whereas over-the-counter medications are medications that have been proven that they don't have very serious side effects, adverse reactions. So you can go to the pharmacy and buy it without prescription. That is it. Now, these medications both are approved by the FDA, the Food Drug Administration and Cosmetic Act. Sure they are. But once again, because they don't present this potential, harmful potential, if you buy it without prescription, you can take it. Now, you should not abuse. You should take the medication right as it's written on the medication envelope or medication bottle. Because if you don't, or if you abuse it, you follow the instructions that are written on the prescription. Because that's how it is when you go to the pharmacy, they tell you how you have to take this medication. Because the instructions do not change, it's just that you don't need a prescription. That is basically what it is. Can you get in trouble taking over-the-counter medication? Of course. If you abuse the medication, if you take more than you're supposed to. So remember, the pharmacy is going to give you instruction. Or the package, the bottle where you get the medication, it says take 1 tablet per day, maximum of these many milligrams at once. How many times per day? But some people don't follow instructions. I can tell you. So that is the issue. Remember, we kind of auto-medicate ourselves. Yeah, I'm gonna buy this. We take anything. And sometimes if we get worse, then we go to the doctor. But that's the intention of over-the-counter medication. So you know that, because remember, keep this in mind because this is important. Over-the-counter medications that do not need prescription. Can they present risk if you abuse? Of course. If you don't take them correctly, appropriately, of course, you're going to get in trouble. Just because they are over the counter does not imply that they're not going to cause any harm. As long as you follow the instructions of the medication, you're going to be fine. Now, remember, sometimes you might not know, you might be allergic to any of the ingredients or the chemicals of that particularly compound. So you have to immediately notify a medical doctor, go to the emergency. So that's basically how it works. It is acceptable for a medical assistant to write a prescription if it hasn't been signed by the physician. You're not supposed to be writing no prescriptions, whether it's been signed or not. So when will be acceptable for a medical assistant to write a prescription? Never. Medical assistants do not write prescriptions because you don't prescribe. How do you know what medication you're going to prescribe? How do you know what is the condition of the patient? So you don't. Even though if someone tell you, hey, just write the medication, write prescription for this medication. Remember, there are lots of items in a prescription. How are you going to know everything? But that's not the case. Even though if you know it, you're a medical assistant, you're a nurse, you do not prescribe, period. So sometimes they can throw questions that makes no sense. And I've been saying it all the time. Medical assistants do not prescribe, medical assistants do not diagnose, medical assistants do not give medications to the patient. That's not your job. So whenever you see things, questions that they said, okay, you are in the medical office, in the hospital, and a patient comes in and they tell you this about medications, what are you going to do? No, everything goes to the medical doctor. You do not get involved in any of those things. You do not diagnose the patient. You might diagnose and prescribe your family members. Oh, I have a pain, take Tylenol. You are prescribing. But nothing is going to happen because it's your family member or your friend. But in the medical field, because you have a certificate, you work in there, you are abide by all these laws. At home with your friends, no, there is no laws over there. But in your workplace, yes. Oh, I have this abdomen. Oh, yeah, you have this. Oh, I have this little lesion, this little rash right here. Oh, that is this. You're diagnosing. Believe me, we do that all the time. We prescribe, we diagnose, we give, lectures to people, advice. We're not supposed to be giving medical advice to no one. That's not your job. So if I'm going over all these, because remember, that is not written here, because those are the type of questions that you're going to get. So when you see something that is related to prescribing medication, you're a medical assistant? No, that's not. So I know that I'm going to take off lots of things from those questions. And one is going to say, oh, no, I'm just going to be registering the patient. I'm going to do a referral. I'm going to be drawing blood. I'm going to be doing vital signs. I'm going to be assisting. Oh, one of those is going to be your right answer. Because anything else, diagnosis, prescribing, giving medical advice to the patient is not something, or giving medications, it is not something the medical assistants do. So pay close attention to that because that's going to come very handy, not only for you to pass the exam, but in your workplace. Because you're not going to get involved in any of these things because that can cost your certificate and probably your freedom. So, no. Electronic e-prescribe. Oh my God, this is the best thing ever. You don't have to be involved at all as a medical assistant. It's just the medical doctor in the office as they evaluating the patient, diagnosing the patient. They already completing a prescription because it's a format that is there, very easy. You don't even have to write the name of the patient because it is computer generated, because you are right directly on the patient medical records. So you just pull out the prescription pad, all the information about the patient is going to be there. Your electronic signature is there, the date, the time is there. So the only thing that you're going to write down is the medication, the dose, how often or frequent the medication needs to be taken, and instructions how to take the medication. Very simple. Very simple. Now, this prescription is not going to be given to the patient. The patient is not going to lose it. The patient is not going to have excuses why I have not taken the medication, because the prescription goes directly to the other end, which is the pharmacy. Which pharmacy is going to go? Well, the pharmacy of the patient's choice, because usually we ask the patient, Mr. and Ms. Smith, do you have a preferred pharmacy where you're going to go and pick up your medications? Sure. What is the name of the pharmacy? So then we enter the information about the pharmacy. Okay, so we send your prescription to your pharmacy. They're going to be calling you to pick up your medication, okay? They actually have, delivery services. If you want, they're going to call you. If you want them to be delivered to your home, no charge, they're going to deliver to you. Oh, excellent. So I don't have to go, bring the paper, probably forget, probably damage, probably lose it. No, the pharmacy have everything. So that's how it works nowadays. Very important. We use, as long as you have internet services, that is it. You have special software for that. That is compatible, interoperable with the pharmacy. So that's basically what it is. So it says right there, two-way electronic communication between physician and pharmacy, not faxing or paper. Well, it's electronic. By the way, as now that I see electronic, they have a question there that somebody told me, then what was the best way to send, to give the patients a prescription or to send patient information about their health? Electronic. Always speak electronic, not fax, not paper, not a phone call. Electronic. Everything that is done electronically is the fastest way and most accurate way to do things now in any field, in any industry. But since we're talking about the medical, applies for the medical. Think about this. I'm teaching classes from far away from you. Overseas. If it wasn't because internet, computers, electronic devices, software applications, I wouldn't be able to do this. So technology has come miles in a good way. Let's talk about the positive part. So that's basically what it is. Potential for information sharing with other healthcare partners. Now, yeah, not only can send this information to the pharmacy, but we can send this information to someone else as long as we have this interoperability software applications. We can just do almost anything with electronics. So that's basically what it is. See, I'm connecting myself right now with your cell phones, with your computers, with your laptops, with your tablets. I don't know which device you're using at this time, but because it's electronic, it is very, very easy to communicate. And for the medical, see, to send the prescription. Back in the days, we have a lot of issues giving the prescription to the patient because they lost it. They damaged it. So we had to replace it. Waste of time. Not anymore. He goes to the pharmacy and that is it. We don't have middlemen anymore. So the patient or the family member that is coming to pick up a prescription is not going to do it anymore. If you call for a refill, we just do the same. Call directly to the pharma and send the e-prescribe to the pharmacy for the refill. That is it. And I can be anywhere. Not necessarily I need to be in my office because this is through the software application that we have. Prescription refills, see, I was talking about prescription refills. So right name, phone number, medication, and pharmacy. At least that's information because remember, it's a refill. This is not a new medication. So when it is a refill, we just need the name of the patient, day of birth, don't forget that, the phone number. What is the phone number for? Because we're going to contact the patient. Or the pharmacy is going to call the patient. How can you send a prescription with a name, but how are they going to contact them? They don't know who they are. Or if they know who they are, they don't know the number. They need to call them so they can come to pick up the medication. So that's basically what it is. So what is it that we have to do? Well, we have to have the medical record number. So all the medical records, and then is where all the information about the medication is going to be. We just need the medication because it's a refill. It was already ordered. We just need to kind of fill the same information, and the medical doctor is going to do all that. Of course, when the patient calls in for a refill, follow the policies of your organization. Do not just give any time. Oh, stop by the pharmacy in 10 minutes. Seriously? They're not going to have the medication in 10 minutes. The best answer is, okay, do you have the pharmacy number? Because, I have it on file. I'm going to give you the pharmacy number. Contact them later on and see if they have your medications. Otherwise, they're going to contact you because they have your number, okay? You just don't want to brush off your patients. You're always going to be kind of, very assistive, very helpful. Because, sometimes they want to take the medications and they need to know. And you don't want these patients to be calling the office every single minute. Hey, 10 minutes, the pharmacy has not called me. Or they don't have it ready. You told me 10 minutes. Don't give no time. Just tell them, here's the phone number. Do you have the pharmacy number? Because, that's the pharmacy that you always speak of. Yeah, I have it. If you don't, I have it right here. You have a pen? You want to write it down? No, that's fine. Oh, no problem. They're going to call you, or if they don't call you, then after, certain time, then you call them up to ask, or you stop by if you live close by. Remember, you had to pull the patient's medical record because that's when you're going to get all the information, but not you. This is what you got to give to the medical doctor. Nowadays, this is talking about paper-based. Remember, these PowerPoint presentations are a little outward, so to speak, because they use all this information about paper as if you were doing it with paper. It says, oh, give requests to pull patient's chart or medical record, meaning that, oh, you're doing it if you're doing it paper. But that same talking, we are talking about e-prescribe, because that's how it is. Because they can ask you questions about using paper-based medical records, or electronic medical records. If they call for a refill and you have electronic medical records, you don't have to pull anything. Why? Just give the information to the medical doctor. They pull out from the computers the patient name and then just complete the e-prescribe. But if it is paper, then you bring the medical records. How can you tell a medical doctor to fill out a prescription refill when they don't have the information? I prescribe medications, but I don't recall what medication was, what was the dosage, how often the patient needs to be taken it. I don't recall any of those. I don't have one patient, I have tons of patients. So don't assume that the medical doctor knows. No, every single time that the patient comes in, pull the medical records. If you have electronic medical records, no problem. Then you get the signing sheet. So they call the patients, are they, as they were scheduled or as they arrive for, following the order on arrival. Give request to the physician. See, this goes to the physician or the medical provider who is prescribing. Because if you don't have a physician, you have a PA there or a nurse practitioner, you're going to give it to them. Then you're going to notify the patient. Remember, you're going to notify the patient to go to the pharmacy that, the prescription was sent over there. Or you notify the patient to come to pick up the prescription that is ready so they can go to the pharmacy and pick the medications up. We have gone through all these processes. Somehow, maybe because it's our medication, maybe because it's our kids' medication, husband, wife, boyfriend, girlfriend, mother, sister, who knows, friend. So we know, because nowadays, mostly everything is electronic. But electronic is not being, it prescribes not being for long, particularly medical doctors. They took longer to get into this trend of using e-prescribe. And some of the doctors still don't have it. Some of the doctors, the old fellows, still giving the prescription pad. So remember, for exam purposes, I mentioned this once or twice, RX means prescription. It's written in every prescription pad, even in the name of the pharmacy. It says right here, RX pharmacy such and such, because that means prescription. So that's basically what it is. Pharmacy does not mean prescription, but pharmacy are the one that dispenses medications when they have a prescription. So if they ask you in your exam, what is the symbol for prescription, RX. R is capital, X is lowercase. It's not capital both or lowercase both. No, one is capital, the other one is lowercase. So that's basically how it is. So we're going to notify the patient. Safeguarding the prescriptions. This happens with the paper-based. Back in the days, we have lots of issues. In other words, they stole the prescription pads. They stole it. Back in the days, you carry your prescription pad, medical doctor, place it on the lab coat, put it on top of the desk, leave it there. Write a prescription, leave that, left the office, the prescription pad is unattended. Someone else can put the ham on it and then they can make fake prescriptions. That's basically what it is. And it happens. And the problem was that many medical doctors have the prescription ready. When I'm talking ready, sign and stamp. So the only thing you have to do is just complete with medication. So we have that issue several times occurring. People stealing the prescription pads. And then they go to the pharmacy calls us that someone they want to verify if the medical doctor actually prescribed. And the medications that they wanted to get were those controlled substances. Surprise, huh? So that's how it is. Someone do not steal your prescription pad because they just gonna go there for Tylenol or Motrin or a medication for diabetes or hypertension. No, they want the good stuff. So that's basically what it is. So we have to keep this kind of secure. Not lock up, well, in a secure place, behind the counter. If it is on the desk of the medical doctor, yes, put a key there. When you leave your room, your office, your exam room, hey, if you don't not carrying with you, my prescription pad, I always have it with me. I have it on my lab coat, and that is it. When I finish, I put it in my desk. Key. Or I take it home with me. Sometimes I have it in my car. But I never left it unattended because I knew the problem. And I knew my name was there. My license was there. My DDA license was there. And something that I didn't know was to apply to stamp these prescription pads. Never did that. Nonetheless, to sign them, no, I have them blank. I have my stamp with me. So whenever I need it, I just do it. But I wasn't kind of having everything ready because that's the problem. Right amount and words and numbers. We talk about this every single time that you complete this prescription pad for the patient. Just write how many pills, tablets, milligrams, whatever the patient needs. The medication has to be in numbers. The units, you have to spell it out. If it is one tablet, it has to be spelled out one tablet. So that basically is studying. Only use one pad at the time. Never leave the prescription pad unattended, not for any other uses. Well, I explain every single time. When it says only use one pad at a time, remember, this is a little kind of booklet. So you use one, stamp that one, sign that one, complete it, give it to the patient. Everything else has to be blank. Because if you complete then and you leave it just for someone to complete the medication, blah, 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 the dose, that can be done by anyone. Not for any other uses. Well, it turns out that the medical doctors use this to give instructions. Oh, go to this particular medical doctor. They write the address, blah, blah, blah. Well, that's not for that purpose. You know why? Because these prescription pads have numbers, sequential numbers. And if I give you this just to give you the address of this particular medical doctor that I'm going to refer you to, or other information, so instructions should not give in a prescription pad. How many times you receive instructions in a prescription pad? I believe many times. I've seen it. I know how it works. So that's what it says there. Not for any other uses, just to prescribe, not to give instructions or addresses or any other information. No. Then you use the post-it, stickers, whatever the names you want to give them. That's basically how it works. Other types of orders, see, that is e-prescribed or written prescriptions. Here, verbal orders. What is verbal orders? Well, you just tell the nurse, or someone else, particularly is for nurses, to give an order to the other medical provider to give a medication. A telephone order. I'm out of my office. I need to give instructions to the nurse or someone else to give medications to this patient. PRN. Oh, I forgot. Now that I'm seeing this. Some of the times when you do not have a certain time, specific time for the patients taking the medication, we write down